Hi everyone, I'm Jin Su. Happy to see you again. In this session, I will explain the assessing phase of the nursing process. Assessing is the first step of the nursing process. Nurses carry out assessment via 4 stages: data collecting, data organizing, data validating, and data documenting. Data collecting refers to gathering information about patients' health status. The nurse collects subjective data and objective data of the patient. Here, let's go over a case, which I hope can help you to understand the concepts of subjective data and objective data. Are you ready? You will have 20 seconds to read the case. Welcome back. Have you finished reading the case? Excellent. There are 2 types of data: subjective data and objective data. Subjective data can be verbal statements from the patient or caregiver. Data include the patient's feelings, complaint of symptoms, perception of personal health status, and etc. Nausea, pain, and feeling of fear are examples. In this case, what Mrs. Lin told the nurse, "My chest feels very tight and I cannot catch my breath," is her feeling and her chief complaints. These are the subjective data stated by Mrs. Lin. Objective data is obtained by observation or physical examination. Vital signs, intake and output, height and weight are examples of objective data. In this case, the nurse measured Mrs. Lin's vital signs, her temperature, respiratory rate, blood pressure. These are the objective data obtained by the nurse. Nurses can obtain data from patients, their family members, and support people, patient records, other healthcare professionals, and literature. Patients can provide the most accurate information about themselves. Family members or other support persons are primary sources of information for infants or children, critically ill adults, and patients who have mental problems. Patient record is a source for the patient's medical history, laboratory and diagnostic test results, current physical findings, and the treatment plan. Reporting and sharing of information among professionals are very important source of the data. Last, review of nursing and related literature such as professional journals and references texts can provide additional information for the database. A patient's database contains all the information about that patient. The database includes nursing health history, physical assessment, history and physical examination by primary care providers, results of laboratory and diagnostic tests, and the material contributed by other health professionals. A health history is typically done on admission to hospital. The hospital will have a form with assessment questions like the list I show you here. The typical components of a nursing health history are patient's biographic data such as name, age, marital status, and so on. Reason for seeking care and history of present health concern. Past health history including patient's allergic history, serious or chronic illness, or recent hospitalization, and so on. Family history, the health status of family members. Lifestyle-related information such as tobacco use, sleeping pattern. Social and psychological data, for example, family relationships, patient's major mental stressors. Culture assessment, for example, patient's religious beliefs. Now we know what subjective data and objective data are. We also know the sources of data and the components of the nursing health history. But how do we collect the data? The primary method used to collect data are observing, interviewing, and examining. Observation occurs whenever the nurse is in contact with the patient or support persons. Patient's facial expression, skin color, behaviors, and environment are all the components of the observation. A good ability for observation relies on nurses' knowledge and experiences. There are 4 kinds of interviewing questions: closed, open-ended, neutral, and leading. Closed questions used in the directive interview are generally require only yes or no or short factual answers to give specific information. Examples of closed questions are: what medication did you take? Are you having pain now? However, if you need more information, open-ended questions are more appropriate. They allow patients the freedom to talk about what they wish. Examples are: tell me about the medication you are taking. Tell me about the pain you are suffering. A neutral question is a question the patient can answer without direction or pressure from the nurse. Examples are: how do you feel about that? Why do you think you had the operation? These types of questions allow the patient to think for themselves. A leading question directs the patient's answer. Examples are: you are stressed about surgery tomorrow, aren't you? This type of question can be used for validating the previous answers of patients. But it also can create problems if the patient wants to please the nurse and gives inaccurate responses. This can result in inaccurate data. The physical examination is a systematic data collection method. Nurses use techniques of inspection, which means observation, auscultation, palpation, and percussion to conduct the examination. Usually, the nurse first records a general impression about the patient's overall appearance and health status. For example, their age, body size, mental and nutritional status. Then the nurse takes such measurements as vital signs, height, and weight. Nurses use the head-to-toe approach to conduct a complete physical examination. While doing the physical examination, the nurse assesses all body parts and compares findings on each side of the body. Instead of giving a complete examination, the nurse may focus on a specific problem area noted from the nursing assessment. such as shortness of breath, and to resolve a patient's problem before completing the examination. During and after obtaining the data of the patient, the nurse uses a written or electronic format to organize the assessment data systematically. Most healthcare agencies have developed their own structured assessment formats, and many of these are based on selected nursing models or frameworks. Golden's Functional Health Pattern Framework, ORAM Self-Care Model, and Roy's Adaptation Model are often used as nursing frameworks and models. In China, many hospitals adopt Golden's 11 Functional Health Pattern Framework to organize the data of nursing assessment. By using Golden's framework to organize data, nurses can identify the functional problem of patients. The information gathered during the assessment phase must be complete, factual, and accurate because the nursing diagnosis and interventions are based on this information. Validation is the act of double-checking or verifying data to confirm that it is accurate and factual. Validating data helps the nurse complete these tasks. Nurses should make sure that assessment information is complete. The objective and related subjective data are concurrent, and they should obtain additional information that may have been overlooked. Differentiate between cues and inferences. Avoid jumping to conclusions and focusing in the wrong direction to identify problems. The nurse records patient data into the written or electronic form to complete the assessment phase. Accurate documentation is essential and should include all data collected about the patient's health status. I will explain the principle and details of documenting in another session. Thank you for your attention. See you next time.